This is Hope and Help with Doctors Michelle and Mark Sherwood. Insights and interviews with a dose of straight talk to help you enjoy optimal health in all areas of life.
So we are back again with a return guest whom I am blessed to call a friend. Dr. Lee is well known in the area of peptides, as well as many other things. He's got more initials after his name than he's got in his whole name, period. So, Ed, thanks for joining us again, man. I appreciate it.
Thank you very much. It's a pleasure to be on your podcast.
All right. So last time we talked a lot about peptides and how that they are trying to be squished and squashed, and went through a little bit of that. And then you talked about a study that was going to be published. So I want to hear all about the updates as well as a study, if it's able to be viewed at this point.
Yes, it can be viewed. And I'd like to start off with a disclosure just to make sure that I don't get in trouble. So for this podcast, I will review the science and studies of some peptides that are not FDA approved, like BPC157. I will talk about thymosin beta-4 because that is also in the study. And this was FDA designated as an orphan drug, but now is considered a biologic, according to the FDA, because it's more than 40 amino acids. This talk is provided as a general guideline and for informational purpose only. The information is not intended to replace medical advice by other physicians, and I do not endorse using non-FDA approved peptides. Let's see. I published a paper, and what's interesting is I didn't know exactly when it was going to come out, but they told me in the July-August issue in Alternative Therapies, and I've been checking every day, and it's like Christmas. Like, when is it coming out? So I knew it wasn't going to be early July, but so late July I was checking it, and actually, I got an email by a radio host, by the guy that basically does Superhuman Radio. He's been doing it for a long, long time. And he's big in peptides. And he wanted to interview me because he wanted to hear more about this paper that I published. So he knew it before I knew it when it was... I knew it was coming out, but he knew when's
the interview? That's what I want to know. When's this interview coming up?
Oh, it's already recorded. So if you go to Superhuman Radio, you can go to their podcast and just click and listen to the one I spoke on. So it was a really pleasant discussion. So the article, the article title is called Intra-Articular Injection of BPC157 for Multiple Types of Knee Pain. And I did basically a retrospective study, and we did a chart review from 2019 to 2020. And there was a pre-med student. His name is Blake Paget. His father's an orthopedic surgeon. And actually, we started together, his father and I, in clinical practice many, many years ago, back in Winter Haven, Florida. I remember he was sitting right next to me, and we're talking to the director of the clinic, and she was asking when we wanted to start our practice. And he said, I have 5 kids. I want to start today. Because they had a mouth to feed. And I was just, we're married, we didn't have kids, and it's like I didn't have to start right away. I said, I'll start a month later. I'm going to travel. So anyway, so I knew his father for over 20 years, and he's taught me how to inject into joints. And so one of his kids is interested in basically going to medical school, and so he hanged out with us, with me in the office, and he kept pushing and pushing. He goes, let's do a study. And it's like, oh, there's so much work. He wouldn't take no for an answer. So I said, okay, I did this kind of little clinical trial in the back of my head. Why don't you dig out all the medical records and give everyone a call and see how they're doing, and then we'll do a chart. We'll basically put it in a graph form and see what the results show. So I have a lot of people like you do that come in the office and they failed conventional medicine, and it's like they don't want to have surgery. They want to try something different. So I said, look, this is experimental. It's not FDA approved. If you like to try it, sign a consent form. And so this is really just all experimental. I'm not going to know if it works, if it doesn't. So my patients basically signed this consent form, and they wanted to try it. So the first 4 patients, I did a combination of thymosin beta-4 and BPC157, and I injected into their joint, into their knee joint. And they were all different types of knee pain. So they're not like all ACL tears and not all meniscus tears. There was osteoarthritis, some had just basically unknown diagnosis, it just was bothering them. Some had failed orthopedic surgery. So we called 17, well, I didn't call, but the student that worked with me tried to contact 17 patients. And 16 we were able to follow up. 1 moved, and we didn't have a phone number to contact or email. So we only got 16 people. So the first 4 basically used a combination of a BPC157 and thymosin beta-4. And the first one, I used very conservative dosing, 2 milligrams, which is like 1 cc of BPC, and 1 cc of thymosin beta-4, 3 milligrams. It did improve initially for the first couple days, and then after that, it didn't get better. But then patient 2, 3, and 4, they got higher doses and basically they improved. So I was thinking, when I was doing this, I said, well, how do you know which one is making the difference? Is it thymosin beta-4 or BPC 157? So I said, you know what? From here on, I'm just going to do BPC 157. So it's like, for me, if I have, if I'm building, or if I'm having my backyard redone, they hate me because I keep changing plans.
Makes sense.
And initially I wanted this, but now I see something different, so I like to change something. So anyway, I had the next 12 patients only got BPC, and they got 4 milligrams of BPC, which is really not that much, 2 cc's of BPC. 11 out of 12 improved, 1 out of 12 did not improve. And you can see that 4 out of 16 people had an MRI. The first one had a tear of the medial meniscus and sprain of the medial collateral ligament. Number 2 had a tear of the meniscus. Number 3 had a tear of the ACL, and 4 had a popliteal bursitis. And I injected only in the intra-articular joint. I didn't even inject into the popliteal area there, and they all improved. And you can see the combination. The first 2 had a combination of BPC-TB4, and subject 3 and subject 4 had just BPC by itself. So the average age was 60, and 9 women, 7 men. And the youngest one was a young athlete, and he's a really interesting guy because he's an amazing athlete. He got recruited to basically race for the U.S. Olympic team, and then came back because he had an ACL tear. I said, what are you going to do? He goes, I'm going to let it rest. And he was on the same cross-country team as my son, but he was a senior. My son was a freshman at that time. He had super amazing times, breaking close to state records. And so I was thinking, your ACL will never repair with just rest. You need a little extra help. So I said, have your father call me. I actually knew his father. I didn't know his contact information. And anyway, he says, yeah, let's try BPC on my son. And the first time he started getting better, but I told him 2 weeks. Don't overdo it. Just don't run. But he started running, and then he did a 9-mile run, and then went to the gym, lift weights, then bam. Actually, he texted me and said, back to square one. So I said, and re-inject, and then he got better. And he's doing really well. So Most injections were done in 2019. One patient had a failed knee surgery for a torn meniscus 6 months prior. So it was a, quote, successful surgery, but the patient still had pain. So, what do you do when someone comes into your office and say, they say it was a success, but I'm in pain. So that's why I say, here, let's try this BPC157. So of the 16 patients, 5 stated that they had previously been diagnosed with osteoarthritis. So in my population, generally, they're over 60 that got the injection. So osteoarthritis is very common. You probably see it in your practice there. So just overall, 14 out of 16 patients had significant improvement with using BPC157. Many different ways in terms of mechanism, but it can actually, BPC157 has been shown in animal studies to regrow cartilage, repair torn ligaments, repair torn muscles. So it reduces inflammation. So this is better than a steroid because the steroid reduces inflammation. It doesn't basically heal or cause healing if you have like a ripped ACL. So this is really exciting. And it's the first human clinical trial. There's a lot of animal studies. So this is more studies should be published. And this is just a hey, this is I have a wellness practice. I have a garden variety of different knee pain. I would love to basically work with an orthopedic surgeon, and basically we just do ACL tears before we get an MRI, and then later another MRI to see, is it just placebo effect, or do you have an objective data to see, hey, the ACL got repaired, and that would be a great study. That's the next study. Yeah. So maybe Blake, if he gets a medical school, becomes an orthopedic surgeon, he could do that second project, which will probably be 20 years from now.
I have some orthopedic surgeon friends, so I may very well contact them about this right here, just because it's very intriguing.
You could do this study too. You don't have to, you could do it too. So.
Well, let me ask you this. I know a lot of people are aware of BPC, and you've talked about intra-articular injections. Obviously, it can be injected subcutaneously, even taken orally, correct?
Yes. So there's 3 different ways that you can actually take it. And one is you could do it by mouth. It comes generally in a 500 microgram or half a milligram troche or pill. It also comes in a cream. Also can come in an eye drop too, by the way. Compounded. But you can do injections sub-Q, which if you have an acute injury, you can basically inject into close to the site of injury, and hopefully that will help. But if you can get into the joint, that will really help that particular knee or shoulder. Hip is a little hard to fix, but anyway, hip is a deep joint. So a lot of people who do joint injections say the same thing about the hip. But generally, the knee really responds well. I have 1 or 2 cases that did not, but anyway, it doesn't work 100%. But anyway, it seemed remarkable results. So anyway, you could do it sub-Q. You could do it basically in the joint, and you could do a pill. And usually after you inject, like when I inject, I say take the pill for at least 30 days to help repair.
Good. That's fascinating. So I got to ask you, are you going to do more studies like this? I know Blake was pushing you. Are you being pushed to do any more?
I'm actually, we just collected data for another study, but don't expect me to do a lot of other studies because it does take a lot of work. And this one is on the peptide, actually not on the peptide, it's on senolytic therapy. So on dasatinib and quercetin. And we could talk about that later down the road.
Yeah.
So it's really exciting. I really, I got the prelim data, so I'm already salivating on it. So
it's awesome. Hey, how are we doing so far? And the last time we spoke, there was a push, really, and I think we specifically talked about thymus and alpha-1. I know you've got that on screen right now. How is it going with that so far?
Well, the good news is we're getting the numbers up. Hopefully, we can get up more numbers, but we're moving in the right direction. So there's literally a 30-second form to fill out to save peptides, especially thymus alpha-1.
Yeah.
And the bad news is I only know one compound pharmacy that actually does thymus alpha-1. And I thought there was 2 compound pharmacies, but anyway, the latest is 1, and it's Brooksville Compounding Pharmacy. And it's, I think, a matter of time before their day is a number. But this is a peptide that has tons, well, I hate to say tons, has a lot of great clinical trials. It's FDA approved in multiple countries. The question that was asked over the past weekend, I did basically a conference with Dr. Luis Martinez online, and basically was with AARN. And he was saying that he could get it from South America because he goes to South America. He's in Puerto Rico, so he's close to Dominican Republic. He's just really close to South America, so he can get it that way. But for most of physicians in the U.S., we're really our hands are tied behind the back, and the only way we can do this is really act as a group. And if you expect just one person to save it, it's not going to work. We need everyone to help out. So it's you just put your first name, last name, email address, and your address itself, and basically a signed petition will be sent to your representative and to your 2 senators in your state. And basically, it's really saying, hey, we got to stop this madness from the FDA because thymus alpha-1 has been a lifesaver for many, many people. And I'd be very sad if it's taken away. So you can go on savepeptides.org, or you can go to clinicalpeptidesociety.com, or I don't know, on your website, if you have it, link to the petition mark, but hopefully you have it on your website and people can just click there. And the petition looks like this. It's so simple. And we're almost to 1,000 supporters. So the number, I think last time we were on the air, we were like, I'm just guessing, maybe 300, so 770. And anyway, we just would love to have more numbers, and we would love for you to sign it and also have at least 10 of your friends to also sign it. And especially if you're a healthcare provider and you have access to other patients, please have them sign it and their friends to sign it. That's the only way this will grow. So,
well, I want to encourage all of our listeners to go there right now, savepeptides.org, and get it done. There's multiple ways you can do that. Ed mentioned every one of them. And so get on one of those things and do it right now. Don't wait, and then share it with your friends. If you are a healthcare provider, you may not do BPC157 or any of the peptides, but the bottom line is they work. And because they work, we need to really embrace the concept of healing and wholeness that we all endeavor to do, and not hold it back. And there is no negative things about these things, is there, Ed?
Not on thymus alpha-1 or even BPC. But anyway, the big issue is thymus alpha-1, and we like to get thymus and beta-4 back too. So you can share it on social media too. I'm not an expert in everything, but unfortunately, I don't do social media. I just don't want the government to watch me. But if you're into social media, post it, please. That's the fastest way.
Yeah, folks, I want to encourage you to do that because I know Ed Lee. He's been on here, 3 or 4 times now, and he wouldn't be on here if I didn't trust him as an individual and a human being. He's my friend. I trust his integrity. I trust his credibility, and he is really a gentleman through and through. He loves God. I know that. And he's telling you the truth. And because of that, we need to stand for truth. It's not time to sit back and say, it's not going to happen to me. None of that nonsense, because it does. And it is. All of our rights and freedoms are being eroded away. One, 2, 3 at a time. And so this is a big deal, man. So, and I'm encouraging everybody to do this right now. It's a huge deal, isn't it?
Yeah, it's really comes down to the core issue of we're going to lose our rights to choose our own medical care. And this is really more on the alternative side, but still it's our right to have access to alternative medical care. And this right will be taken away. And this is a natural peptide produced, the thymus alpha-1, from our thymus gland. It is not altered. It's basically has been discovered by Dr. Allen from George Washington University. And basically they've shown that in clinical trials that this saves lives. And so this is like a key element to keep your immune system healthy.
Yeah, and the immune system is such a point of discussion today in our world, is it not? Now, I see the screenshot here. You've got 770 subscribers. You told me we're at 1,000, so we've got to get that 10,000 goal. That's it, right? Well,
yeah. I mean, that's I like to hit first 1,000, and then it's like baby steps. But sometimes something has to be taken away before the big anger comes out. Sometimes it's unfortunately, I hate for it to happen, but if it does come to the day that we can no longer get thymus alpha-1, then I really think hopefully everyone gets upset, and that's what we need. It's just don't wait to act now. Anyway.
Well, I agree. It's called righteous anger at this point, folks. Step up. Stand up, speak up, don't take a step back, have some backbone, and don't back up. That's the bottom line. And that's the best way I know how to tell you to do this. Go right now to savepeptides.org, put it in there. Many of you on this podcast have used these things. You know the miracle benefits of these. And we have to save one. We have to save this thymus and alpha-1 right now. And we'll do that, but we need all your help. All your help. All of us got to bond together to do the right thing, and not just this, but a lot of things. So, Ed, man, thank you. This is great. Really appreciate this. We need to come back, talk about another peptide or two, and come back and talk about where we are in our progress of saving peptides. Can we do that?
Yes, definitely. We'll set a date. We'll talk and get a date. So, looking forward to it. So
I can't wait. Man, you're an awesome wealth of information. Thank you for doing that study. That is wonderful. I'm glad that Blake went ahead and pushed you over the top in that. So it's awesome.
I'll have Blake come to your office.
Yeah, I know. Blake will push us up here in Oklahoma to do a little bit of stuff.
Because he heard you that you have some orthopedic friends.
Yeah, I do, and they're really close. Hey, man, thank you, Ed, for everything that you do. Thanks for being my friend, and thanks for what you do for so many people out here in this great big world. Really appreciate you.
Yeah, we've been blessed by God, so we really need to fight, and that's the problem with physicians. We like to help, but most physicians don't want to fight. So yeah, that's the downside. We really need to fight for this.
We need to begin to fight for righteousness, period, ladies and gentlemen, and it starts with little baby steps. You got to have some confidence, and you see people like Dr. Edwin Lee stepping out front. When I was on the SWAT team, I remember somebody had to go in the door first, and Ed, you're going in the door first. And I appreciate that very much. So we must follow and get on board with truth once again and step up. So we're going to do this again and keep this going and build that petition base until we get all the way up to 10,000 and more.
Cool. That'd be great. Thank you.
I appreciate you, man. And I look forward to seeing you next time. And wow, folks, what a cool episode today. I mean, amazing. We'll make sure to post the link again, even in the feed underneath this, of course. And we'll look forward to seeing Dr. Ed Lee, my friend, back on the podcast soon. So we'll see you next time on hope and
Doctors
health.
Mark and Michelle Sherwood and their clinic can help you find the hope and health you were created to enjoy. Go to sherwood.tv for clear, proven ways you can be healthier. Subscribe at sherwood.tv